right now on Fox 5 News at 6.
The long, strange trip continues for people over the age of 50, how they're bucking the current downward trend when it comes to illegal drug use.
Good evening. Thanks for being with us. I'm Steve Lacey. Well, everywhere you look, the anti-drug message is aimed at kids, teens, and young adults. But new numbers today show that maybe that message needs to be redirected at their parents and even grandparents. Take a look. New government study shows illicit drug use, which includes marijuana and harder drugs, has more than doubled in people between 50 and 54 years old. It's more than tripled in people between 55 and 59. And it also applies to people in their early 60s as well. But why are more older Americans turning to drugs? Sharon Crowley joins us live now in Yonkers with some possible answers. Sharon.
Yeah, that's right, Steve. We talked with a doctor who treats addictions, and basically the bottom line is he says these people were using drugs in their 20s and pretty much never stopped, and that is what accounts for this increase, especially in baby boomers, people over the age of 50 using illicit drugs. And far and away, he says the drug, and the study shows the drug that these older adults are using is marijuana. And with the push for medical marijuana going on, the doctor that I talked to said many people are fooled into thinking that it is not addictive and not dangerous, and he told me that is simply not the case.
Marijuana is a very dangerous drug. I'm sorry to say that as a doctor, but it is. It absolutely has been shown in very excellent studies to affect your IQ, to affect your executive functioning, your neocortex, your frontal lobe of your brain. So it's hard for kids to make decisions, things like that. I think it's very much a sign of the times. I couldn't help but when reading the study thinking to myself, a lot of people are out of work, a lot of people are struggling, they're seeing their kids move home again. They thought they were free, especially those of us who were in our 50s. We thought we were finally free. They're back. I guess that could really make you want to get stoned, you know, and obviously that's what the statistics are bearing out.
Now, that was Dr. Harris Straightner with the Karen Drug Treatment Facility, and I asked him about treating people with these conditions, and he said, of course, obviously, he sends a lot of his patients to rehab because he wants them to get off substances and clear their head, and then there is ongoing therapy and treatment, sometimes with medication. But bottom line, Steve, it is about stress management and not turning to illicit drugs to try to handle that stress. I'll send it back to you in the studio.
All right, very good, Sharon Crowley. We appreciate it.